again, and welcome to PodcastDX, the show that brings you interviews with people just like you, whose lives were forever changed by a medical diagnosis. I'm Lita.
I'm here.
Okay.
Ron will not be joining us today.
Today we're going to talk about a topic a lot of people put off, avoid, or joke about, but it saves lives: colonoscopy and colon cancer screening.
Don't be the butt of a joke.
We'll talk about why screening matters, when to start, the different kinds of tests, what to expect from the colonoscopy, how certain medications and medical conditions can complicate the prep, and what we're learning about differences between men and women when it comes to colonoscopy.
So why are we devoting a whole episode to colonoscopy and screening, you may ask? Well, that's because colorectal cancer, cancer of the colon or rectum, is one of the most common cancers, but it's also one of the most preventable and treatable ones when it's caught early. Screening can find polyps, which are small growths in the colon, before they turn into cancer, and it can detect cancers at an earlier, more treatable stage.
We're also seeing more colorectal cancer in younger adults, which is one reason guidelines have changed over the last few years. So this isn't a topic for people in their 60s and 70s. It's relevant to people in their 40s and sometimes even younger, especially if they have a family history or other risk factors.
And let's be honest, some people are hesitant or scared of colonoscopies. There's the prep, the idea of the procedure itself, the embarrassment that they might associate with it. But we're going to break down all of that and hopefully make it less intimidating.
Well, let's start with the basic question: when? When should most people start screening?
For the average individual with an average risk factor, meaning that they don't have a family history of colon cancer, that they aren't currently or weren't, have not had any inflammatory bowel disease, and don't have any specific colon or rectum cancer related genetic conditions. So major groups like the U.S. Preventative Services Task Force and the American Cancer Society now recommend starting routine colorectal cancer screening at age 45. And that's a change from the start at 50 rule. And it reflects a rising colorectal cancer rate increase in people in their 40s and earlier. So from 45 to 75, screening is strongly recommended for most adults. From 75 to 85, it becomes more of an individual decision based on overall health, previous screening history, and life expectancy. And over the age of 35, routine screening...
No, not 35.
85, okay. I'm sorry. Over the age of 85, routine screening is generally not recommended.
If you're at higher risk, then you may need to start earlier. For example, if you have a first-degree relative, a parent, a sibling, or a child who had colon cancer or advanced polyps, some guidelines recommend starting at 40 or 10 years earlier than the age when your youngest affected relative was diagnosed. So if your youngest affected relative was diagnosed at 30,
then you're starting at 20.
20.
Okay.
Yes, it's all like a connected thing.
Yep. So talking about your family history is important when you go to your healthcare provider.
Yes, and if you don't know your family history,
you're going to, consult your healthcare provider with what their recommendation is. And if you should start at the routine screening age of 45.
If you have certain genetic syndromes or inflammatory bowel diseases like ulcerative colitis or Crohn's, your gastroenterologist may recommend even earlier and more frequent colonoscopies.
But the big takeaway here is that if you are 45 years of age or older and have not yet been screened, it's time to talk with your healthcare provider. And if colon cancer runs in your family, you may need to talk about screening earlier and before the age of 45. And a lot of people hear screening and immediately think colonoscopy. But there are actually several options available, and let's walk through a few of them.
Oh, the main categories are the ones done at home, which are stool-based tests, There's also the ones that look for hidden blood in the stool, usually done once a year, and that's called FIT, or fecal immunochemical test. There's also a test that looks for certain DNA changes from your colon cells plus blood, usually done every 1 to 3 years, often every 3 years for average risk adults, and those are stool DNA tests. Of course, we have the visual test of the colon, which is colonoscopy, which uses a scope to look at the entire colon, usually every 10 years for average risk adults, if the result is normal. There's also CT colonography, which is a virtual colonoscopy, a special CT scan every 5 years if available. There's also the flexible sigmoidoscopy, which looks at the lower part of the colon, usually every 5 to 10 years, sometimes combined with yearly FIT, or fecal immunochemical test. It's important to know if you use a stool test or a CT scan and the result is positive, that needs to be followed up with the colonoscopy to actually look inside the colon and remove polyps if they're found.
And standard guidelines usually say that any of the recommended tests are, good to do. If you and your provider should choose the best recommended course of action and testing based on your individual risk, your preferences, and what is available to you in your area and at your healthcare facility. The best bet is the one that you are willing to actually do and to keep and repeat, testing on a regular schedule.
Right. Testing is the key.
Right.
Ignoring it is not a good key.
Okay.
Okay, let's zoom in on colonoscopy. I got a visual on that just now. Since that's the one that people worry about the most, and it's also the most powerful tool we have. Colonoscopy is unique because it's a one-step test.
Well, you say one step,
If
but
if
they don't find anything.
Okay. And if you don't include the prep.
Yeah.
The doctor can see the entire colon and rectum and remove polyps during the same procedure. Studies suggest that colonoscopy, when done at appropriate intervals, can reduce colorectal cancer incidence by about 69% and death from colorectal cancer by about 68%.
And for most average risk, not at risk, for most average risk adults with normal colonoscopy test results, the next test will not be for an additional 10 years. You get a 10-year hiatus. And if you have polyps, a family history, or certain other conditions, the interval may be shorter, like, maybe every 3 to 5 years. It really depends on what's found and what your health history.
Right. So colonoscopy does two things. It can find cancers early, and it can prevent some cancers from developing by removing polyps before they turn into cancer. So I guess polyps are like baby cancers. They're abnormal cells, and they could turn into cancer, so they want to get them out of there. That's a big reason why many experts consider it the gold standard, even though other tests are also valid.
And let's walk through typical colonoscopy from a patient's perspective, because sometimes the fear comes from not knowing what to expect.
That's true, really. There are probably YouTube videos, too. I'll put those on our website.
Okay.
First, you'll have a consultation or instructions from your gastroenterologist or primary care provider. They'll review your medications, especially blood thinners, diabetes meds, iron, and certain heart or seizure medications, and tell you how to adjust them beforehand. Then comes the part everyone talks about, the prep. You'll be asked to follow a special diet for a day or two, often clear liquids the day before, and then you'll drink a bowel prep solution to clean out your colon. Yes, you'll be going to the bathroom a lot. It's not glamorous, but it's temporary, and a good prep makes the test more accurate and may let you wait longer before your next one.
Right. And test prep is often now shorter in duration and not as limited as it used to be. So there are strides being made there. On the day of the procedure, you may check in at like an endoscopy center or a hospital. They may give you, they'll place, typically place an IV, and typically, it's not required, but it makes it more comfortable and you won't remember anything. So they may give you some sedation or anesthesia. So, you may feel like, oh, you're going to be embarrassed. You're not. If they're going to give you that, then you might not remember any of it. And you'll remember getting the IV, and then you'll remember waking up. And then your healthcare provider advances a thin, flexible tube with a camera, just like I don't know if you've ever seen like a plumber.
Yep.
Yep, very similar. Looking for issues through your rectum and into the colon, and they're going to look for polyps or other changes or abnormalities. Most people are asleep or sedated or very relaxed because of medication, but you can't. You can. I've done it both ways. And I've seen the camera go in, and I was like, oh my gosh, don't ever want to see that again. But you don't have to watch the camera. But you typically don't feel much, if anything, maybe just a little bit of pressure during the exam. And the whole procedure takes around maybe between 20 and 45 minutes. It depends on whether or not they're going to be removing any polyps. And plan for, enough time to check in, and plan for enough time to recover.
Afterwards, you'll be monitored while the sedation wears off. You'll get a brief report on what they found, and you'll need someone to drive you home.
Mm-hmm.
Not an Uber driver. Has to be a friend or a family member. You might feel a little bloated or gassy from the air used during the procedure, but most people feel pretty normal by later that day or the next.
Mm-hmm.
And before we move on, we want to spend a few minutes on situations where the bowel prep is more challenging, because not everyone's gut behaves the same way.
Right. Some medications and medical conditions can slow the gut down, and that can make the standard one-size-fits-all prep less effective unless you talk to your care team about it and they make adjustments. So some medications that may slow your gut motility include opioid pain medications, like narcotics, oxycodone, hydrocodone, morphine are examples there. And they're known to cause constipation. So anything that might cause constipation is going to be essentially slowing things down. And they've been linked to challenges when it comes to bowel prep and bowel prep quality, and a higher chance that the colon isn't completely emptied. So if you are on any medications that slow down your gut motility, talk to your healthcare provider what you can do. Some antidepressants and psychoactive medications can also contribute to constipation and make bowel prep more complicated or challenging. Newer weight loss medications or diabetes medications like GLP-1 antagonists, such as semaglutide, yes, and similar medications can slow down stomach emptying and sometimes affect the GI tract. So recent updates suggest that many patients can keep taking them with careful liquid diet and individual risk assessment, but make sure you consult your healthcare provider and let them know any medications that you're taking, because they may need to make modifications to your bowel prep.
And when we talk about GI tract, we're not talking about like G.I. Joe.
We're talking about the gastrointestinal tract.
Yes, we should have spelled that out.
Okay.
Then there are medical conditions that slow things down. You might have chronic constipation, especially if you have fewer than 3 bowel movements per week. It's a known risk factor for inadequate bowel cleansing. You may have diabetes, which can affect the nerves that control gut movement, and it's associated with a higher rate of poor prep and needs careful adjustment of diet and diabetes medications during the prep. You might have Parkinson's disease or other neurological or neuromuscular conditions, which can slow colon transit and also linked with more frequent inadequate prep. If any of these apply to you, it's important to tell your doctor before you get instructions so they can personalize your regimen.
And some women also have unique factors that affect comfort and prep. For example, a history of C-sections, hysterectomy, endometriosis surgeries, or pelvic organ prolapse repair. That can change how the colon sits and in the abdomen and may make the scope path a little bit more twisty. And hormonal shifts around pregnancy, perimenopause, and menopause can also influence bowel habits and constipation risk. So when you're talking with your healthcare provider, you may ask how such conditions will affect how your colonoscopy is run and if they have experience with those. And some women feel more comfortable, and it is an option in some areas to have an all-women team or woman team conducting your colonoscopy. So if that is a concern for you, you can ask your healthcare provider about that as well.
And for people with these risk factors, some centers will start a boosted prep, like adding stimulant laxatives, for example, bisacodyl, a day or two before the liquid prep. They might use a split dose prep where you drink part of the, you don't drink part of the evening, you drink part of the.
I don't think you're supposed to drink it all as far as alcohol
you
goes.
drink the mix.
Right.
The mixed part the evening before and part the morning of the procedure. So you split the dose into 2 days. You might be given extra instructions on constipation management in the days leading up to the colonoscopy, like really adhering to a liquid diet. The goal is not to punish you with more prep, but to avoid having to repeat the whole thing because the colon wasn't clean enough the first time.
Right.
And if you're on opiates or GLP-1 medications or the certain antidepressants, or if you have diabetes or Parkinson's or long-standing constipation or a history of pelvic surgery, it's okay to say explicitly, my gut is slow and my anatomy might be a little complicated. Do I need a different prep plan or a longer prep?
And we also get a lot of questions from people who we talk to about colonoscopies, because that's the topic we like to bring up most often. But, people, you might be asking yourself, is a colonoscopy different for men and women? And whether women, being typically smaller in stature, should drink less prep. And recent research actually has looked into this, and a large multi-center study in the Journal of Women's Health found that women more often than not had good or excellent bowel prep, while men were more likely to show up with inadequate bowel prep. And the same and other studies have also found that men had higher rates of polyps and colorectal cancer overall, which means that careful inspection is especially important in men. So you want to make sure that you're getting adequate prep and that you're following the directions.
I wonder if they should give men more prep.
Yeah, well, you can ask your healthcare provider, do I need to?
Based on my size or
and if
build?
Based on your prior, they said in a prior colonoscopy, there was inadequate prep, then you might want to bring that up as well.
Definitely.
Okay.
Well, at the same time, women's anatomy can make the procedure itself a bit more technically challenging. Women tend to have longer, more mobile colon.
Are you laughing because you have a shorter
colon? Half mine is gone now.
Yep.
And prior pelvic surgeries or gynecological conditions can increase looping. That's where your colon loops inside and make insertion more difficult, sometimes requiring more time and repositioning. That's why some experts recommend scheduling slightly more time for colonoscopy in women so endoscopists, that's what they're called, aren't rushed.
That makes sense. Importantly, standard guidelines and prep instructions do not currently say that women should routinely get less volume in prep just because you might be smaller in stature. Most regimens are based on what reliably cleans out the colon, and the dose adjustments are usually made for medical reasons. as we've mentioned before, and or if your body size is significantly different from a standard size, but if you're concerned, ask your healthcare provider, and they can individualize and make suggestions there.
Right. The data suggests that men are more likely to show up with an inadequate bowel prep for whatever reason.
Mm-hmm.
So they may need extra emphasis on following instructions closely, or in some cases, more aggressive regimens. Women may have good prep quality, but need endoscopists that anticipate a potentially longer and more complex insertion because of colon length, mobility, and prior pelvic surgery.
And if you have any concerns, because when you get the Jugo prep, that if you're concerned that the volume is too much for you because of your size, your heart, or your kidney function, because it is, it could put a strain, or other medical issues, that's a conversation to have with your gastrointestinal team and your healthcare provider. And they can sometimes choose a different prep formula, adjust timing, or give you specific safety instructions. And because you are typically taking in a great quantity of this prep, you do tend to get cold. So, we talked about that you're going to need someone to drive you home. So you may need the day before. I mean, here's the thing, it's your life, but you might need to take the day before and the day after, as well as the day of. So
and butt paste is a very good thing to have on hand at the end of this prep.
So you might need for the day, of prep to be close to facilities, to have comfortable toilet paper or a bidet,
Yep.
Things of that nature. Getting ready for your colonoscopy.
Yep.
You might want, to be, have a warm blanket, dress warmly. There are some considerations you might want to ask your healthcare provider. You need to take the day before and the day after. But the bottom line is...
The bottom line?
Yes. Don't make adjustments on your own. Always follow the plan with the healthcare team and take the advice that they give you. And if you have any questions, make sure you address them. And even, you don't want to take any undue risks. Any medical procedure does have risks, and this is one of them. So let's talk about what are some of the risks when it comes to getting a colonoscopy.
Well, serious complications are rare, but they can include bleeding, especially after polyp removal, perforation, a small tear in the colon wall, or reactions to the sedation. The overall risk of serious complications is low, but for most people, the benefits of screening outweigh the risks, especially between the ages of 50 and 75, and now starting at 45. Well, then why didn't we say that? Especially between the ages of 45 and 75.
Okay.
Your doctor will weigh your age, other medical conditions, and medications before recommending a colonoscopy, and will talk through the specific risks in your case. If you're very elderly or have multiple serious health problems, they might recommend a different approach or decide that screening no longer makes sense. Not everyone is ready to jump straight to a colonoscopy, so let's talk a bit more about the non-invasive test.
Okay. Well, we had mentioned the FIT test before, the fecal immunochemical test.
Do you have to have a prep before? I'm sorry, I'll leave it alone.
Okay. And this is a small kit that you use at home to collect a stool sample, and then you send it in, and a lab looks for hidden blood in the stool, and it's usually done once a year or so. And it's a simple, you have no prep, no diet changes, and it's typically low in cost and, more accessible for people who aren't close to a healthcare facility. And if it's positive, though, you will still typically need a colonoscopy to look for an issue. There's the stool DNA test, like Cologuard, which you may have heard of before, and that also uses an at-home stool sample kit, but it looks for DNA changes from colon cells and blood. And That's typically done every 3 years for the average at risk or average risk patient. And then there are more sensitive. The Cologuard and DNA tests are more sensitive than the FIT test for detecting existing cancers, but can miss many advanced precancerous polyps and can also have false positives, which would be alarming and also result in a potential colonoscopy.
Yeah.
Okay.
There are also emerging blood tests
Mhm.
for colorectal cancer screening, but some guidelines note that current options may not be sensitive enough,
Okay.
especially for precancerous lesions.
hmm
So they're not yet first-line tests.
Okay.
But if you're interested in those, it's important to talk to your provider about what's known and what isn't yet. The key is if a non-invasive test is positive, colonoscopy is the next step. Think of stool-based tests as screening tools and colonoscopy as both diagnostic and preventative procedures.
hmm And keep in mind, just like the book says, everybody poops. Well, everybody's likely to get a colonoscopy too. Some listeners might think, I feel fine. I'll wait until something feels off or feels wrong, but why is this thought
Risky.
risky? Because early colorectal cancer and precancerous polyps often, cause no symptoms at all. And by the time you do notice blood in your stool or significant weight loss or anemia or other changes with your bowel habits, the disease may already be more advanced.
And screening is about catching things before you feel sick. That's screening.
Mhm.
Or preventing cancer before it appears. That's why the age-based recommendations matter, even if you feel perfectly healthy.
Of course, if you do have symptoms like rectal bleeding, and that might be bright red blood or dark black tarry stool or anywhere in between, persistent abdominal pain or unexplained weight loss or big changes in your bowel habits, please talk with your healthcare provider right away, regardless of your age. There's no longer just screening, at that point, it's an evaluation for symptoms.
Well, let's talk about the emotional side.
Okay.
It's not just the science that keeps people from screening.
Right.
It's fear and embarrassment.
Right. Well, absolutely. People worry about,
The prep.
I was going to say, what you have to do to get ready for the
Yes.
procedure. Are you going to be stuck in the bathroom all day? The procedure itself, is it going to be embarrassing? Is it going to be painful? Is it going to hurt? Is it in a private area? And the results, what if they do find something? What then? For many people, the fear of a bad result can actually be bigger than the fear of the test itself. But avoiding screening doesn't remove that risk. It just removes the chance to catch something early on when it's easier to treat.
It can help to remember this is routine for the medical team. They do these procedures all the time. Seen one, but you've seen them all. You're usually sedated and draped. You're not awake and exposed in the way people sometimes imagine. They put a sheet over you. The staff want you to be comfortable, and you can tell them if you're anxious. Cultural and historical factors matter too. In some communities, talking about bowel habits or rectal exams is especially taboo. Where are those? Because I got to stay away from there.
Well, I mean, if you think about it, swear words are just, talking about functions.
Okay. Yeah, I get it.
Okay.
Mistrust of the medical system could be real. That's why having culturally sensitive providers, community outreach, and honest conversations is so important.
Colorectal cancer screening isn't just an individual issue. It's often a family issue, especially when there's a history of colorectal cancer.
Yeah.
How many people, are comfortable starting that conversation? You might want to say something like, hey, my doctor told me it's time for a colonoscopy because I'm 45. Have you had yours yet? If a relative has had colon cancer or large polyps, they can tell younger family members, because of my history, you might want to ask your doctor about starting screening a bit earlier.
And if you're the one who's nervous, you could ask a friend or a family member to help you schedule it, give you a ride, check in on you during the prep. Sometimes just knowing that you're not going to go through it alone makes a big difference.
And if your loved one keeps putting off their colonoscopy, you might want to help them by trying to focus on why they matter to you. For example, you might want to say, I want you around for a long time, and I know that it's not a fun procedure, but screening is one concrete thing we can do to help find things sooner. Yeah.
Right. Let's share some practical strategies because
getting ready for
the test is the part that people complain about the most.
Yeah, you know what? I think when Sean turns 45 and has to have it, he'll be like, oh my God, the prep.
I'm sure. Some tips that people often get from clinics and patient resources. This patient individual, I'm going to add mine first.
Okay.
Butt paste.
Okay.
It's a cream in a tube.
As long as you don't have any allergies or sensitivities to it.
You could find it in a drugstore by baby items because people put it on baby butts to avoid diaper rash.
Okay.
It is a marvelous product if you're not allergic to it.
Mm-hmm.
Chill the prep situation.
The solution?
Chill the prep solution and use a straw to drink it faster and bypass most of the taste. But they give you a
flavor packet.
Yeah,
it still is odd. For those of you who don't drink flavored beverages that contain. Well, anyway, yeah.
Well, also it's important to use clear drinks that you actually like that are allowed to stay hydrated. Broth, electrolyte drinks, certain juices or tea as instructed. And why they're worried that you're going to be dehydrated when you're drinking that whole jug of stuff, because it's going to come out just as quick. You should have soft toilet paper or wipes and a barrier cream, there you go, handy to protect the skin. Always follow the exact instructions given by your care team.
And if you have any medical conditions, for example, diabetes, or if you're living with kidney disease or heart failure, or if you are currently taking or have taken blood thinners, make sure that you get personalized instructions based on your health history and your current health condition and your current medications. Don't just follow the generic prep or guidance from the internet. And also plan ahead. You might want to, if you can, clear your schedule, set up the day before, as we said, with a comfortable space, a warm blanket, and entertainment that's also near a bathroom.
Yes. As we wrap up, what do we want listeners to remember about colonoscopy and cancer screening? Well, number one, that colorectal cancer screening is not optional extra credit. For adults in the recommended age range, it's a core part of a routine preventative care, like mammograms or blood pressure checks. Mm-hmm. And you often have choices, colonoscopy, stool tests, or other options. So talk with your clinician about what fits you best.
And if you're over the age of 45 or and you haven't been screened, or if you're younger with a family history of colorectal cancer, this is your nudge to bring it up at your next healthcare provider appointment and ask what colorectal screening is right for me and when should we start?
Oh, that sounds
Is today
exciting.
Too soon?
Screening can feel awkward. It could feel inconvenient, but it's a short-term hassle in exchange for a real chance to prevent a serious, sometimes deadly disease.
Right.
Future you and the people who love you will be grateful that you made that call.
And we hope that this episode has made colonoscopies and colon cancer screening feel a little bit less mysterious and a lot more doable. You can do this. If you've been putting it off, consider this your sign to take that next step. As always, the specifics, like which tests to use and how often, it'll depend on your age, your risk factors, and your overall health. Your healthcare team can help you personalize a plan that makes the most sense.
Yeah, personalized medical care.
Yep.
This podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified healthcare provider with any questions you may have regarding a medical condition or treatment and before undertaking a new healthcare regimen.
Mhm.
Never disregard professional
It was funny before all the stuff happening now.
Yeah. Never disregard professional medical advice or delay in seeking it because of something you've heard on this podcast. Till next week.
Prep.